Hi, I'm Lisa Coffey, and February is Heart Health Month. I'm here at the California Health and Longevity Institute to speak with some experts about what we can do to keep our hearts healthy.
By 2020, heart disease will be the #1 cause of death worldwide. Heart disease is not curable but treatable and certainly preventable. It's all to do with lifestyle and what you eat. And also being aware of what your risk factors are.
Most of the risk factors for heart disease are modifiable. We can do something about them. Really, gender, age, and family history are the only three. Everything else we can do something about and literally reduce that risk to near zero of getting heart disease. Get in for that annual physical exam. Sit down with your physician, have the discussion. Do I have high blood pressure? What is my cholesterol? And to know your numbers. Gain that knowledge and then apply them to initially diet, exercise, and then what kind of screening test should I have to see, do I have heart disease?
Probably the most important thing to have healthy hearts is to keep the saturated fat content of the diet low. One of the ways we can keep it lower, and again for women it should be about 11 grams a day for women and children, and for men about 16 grams a day, is not eating excessive amount of animal protein. The more quantity of protein you eat, the more saturated fat. Everyone thinks that fish and chicken are fat-free or very low, but they still contain some saturated fat. Think about using some vegetarian food sources here in your diet as well, whether it's just having beans and rice a couple days a week for lunch or eating a veggie burger 1 or 2 days a week, and that's a good way to bring the saturated fat content down in your diet. We have to look at labels on food. Fruits and vegetables have no saturated fat. Our diet should be extremely high in fruits and vegetables, 7 to 10 servings a day, because those antioxidants and that fiber protects your heart from getting heart disease. The average meal in a restaurant is 15 to 2,000 calories. And so this is why when we dine out so much, it's so hard to watch your weight and to stay very healthy in terms of weight, because the calories are so concentrated in food because they add a lot of embellishments, the portion sizes are high, and there's a high fat content to the food. And what's missing when you eat out is they don't have the high level of fruits and vegetables that we'd like to see in with meals. It gives us the volume that doesn't give us the calories. So if you can put a cup or two of vegetables on your plate for maybe 50 to 75 calories, that can get your plate volumized without having a large amount of protein or carbohydrate.
Cardio exercise gives you probably the biggest bang for the buck in terms of single exercise. It reduces the risk of certain cancers, you sleep better, people are actually more immune to viral and bacterial infections, and if it's a weight-bearing exercise, it can help to prevent osteoporosis. The list goes on and on and on. We know that you can get health benefits by accruing or accumulating 10-minute bouts of exercise in the course of a day, and that could be at a low to moderate intensity. But the research also tells us that when you exercise moderate to vigorous, you up the ante in terms of the benefits and the reduction of risk of cardiovascular disease. In other words, that sweating, that heavier breathing, that's a good thing. The effect that exercise has, particularly cardio exercise, on stress management is one of the best exercises that you can do. What we do at the Institute here is we promote Kaizen philosophy or methodology, and that talks about just taking small steps. So that journey of 1,000 miles begins with the first step, that baby step. So if you're not accustomed to exercise, I might say on your lunch hour, go out and walk for 5 to 10 minutes. And most people, that's doable.
We really pride ourselves on the 360-degree approach to health and longevity. There's many life domains that translate to promoting chronic disease prevention and increasing quality of life, in addition to exercise and healthy eating habits. So I also speak to people about, cognitive reframing techniques and how to reframe a negative into a positive, and how to implement simple techniques like breathing, visualization, mindfulness-based trainings, meditations, other flow-type occupations that can be instrumental at decreasing your blood pressure, decreasing those cortisol levels, and really helping you build a resilience to stressors over time, which is going to be key to sustaining not just your weight, but being preventive of heart disease. Because if we stay balanced in our mind, we'll stay balanced in our heart, in our physical body as well. So I think that's probably the best advice to follow.
So basically, heart health is our own responsibility. We can take care of ourselves with a healthy diet, a healthy lifestyle, and lots of exercise. I'm Lisa Coffey for Coffee Talk.